Hi there, Proactive Podiatry here again, and today we will be going through the topic of foot ulcerations, understanding types and treatments. What are foot ulcerations? They are open sores that fail to heal properly, often caused by poor circulation, nerve damage, infection, or pressure. They can progress quickly if left untreated, which leads to serious infections or even amputations. There are different types of foot ulcerations. The first two are neuropathic ulcers and ischemic ulcers. Neuropathic ulcers comes from the loss of sensation, which is commonly from diabetes, which causes unnoticed pressure or injury, usually seen on weight-bearing areas and are slow to heal. Ischemic ulcers are caused by poor blood flow due to peripheral arterial disease and can usually be seen on toes, lateral foot, or heel. It is painful, deep, and dry with a punched-out look. There is also venous stasis ulcers and pressure ulcers, also known as decubitus ulcers. Venous stasis ulcers comes from poor vein circulation return, which causes blood pooling and tissue damage. It is usually seen in the inner ankles or lower legs. It has irregular edges, shallow, and is surrounded by swelling or discoloration. Pressure ulcers, on the other hand, are caused by constant pressure, friction, and are often seen in bedridden or immobile patients. It can be found on heels or other bony area and can range from looking red to deep wound exposing bone. We also have post-traumatic ulcers and infectious ulcers. Post-traumatic ulcers are caused by repeated injury, friction, or poor healing after trauma and can happen in any part of the foot, but healing depends on the underlying blood flow and nerve health. Infectious ulcers are bacterial or fungal infection after skin breakdown and may be found anywhere with poor hygiene or untreated wounds. It is red, swollen, painful, and produces drainage. Next are malignant or Marjolin ulcers and mixed or neuroischemic ulcers. Malignant ulcers are chronic, non-healing wounds that undergo cancerous change, but that is usually rare. These type of ulcers always require a biopsy and urgent care. Mixed ulcers are ulcers with a combination of nerve damage and poor circulation. It is common to see in advanced diabetes. This type of ulcer is very difficult to heal and has a high infection risk. Now for management and treatment. In regards to ulcers, there is a process for it. It is done to identify the underlying cause, such as neuropathy, poor blood flow, infection, and other comorbidities. The usage of diagnostic imaging or vascular testing is done if needed, such as CT scans and MRI. Next, we have wound care. It is the regular cleaning and debridement, known as removal of dead tissues. It uses dressings to keep the wound moist but clean, and when indicated by the podiatrist, application of topical antibiotics or advanced wound products will be done. We then have offloading and pressure relief. These are custom orthotics, paddings, or special footwear is used to reduce pressure on the wound. Other durable medical equipment, DMEs, such as walking boot, surgical shoes, crow walking, and peg assist are also used for offloading. Next is infection control. A culture test will be done and antibiotics will be dispensed for bacterial infection. Treatment for fungal involvement will be administered if fungus is present, and patient must monitor for signs of deep infection or osteomyelitis. Next is circulatory improvement. It is the encouragement of the discontinuation of smoking and proper foot care. If blood flow is severely compromised, patient may be referred to vascular specialist to restore blood flow to ulcerated wounds. The patient then returns to the podiatrist for continued wound care and dressing. Implementation of soft wave or laser therapy will also be done to increase blood flow and promote healing. Last but not least are surgical options, only when necessary. These are surgical debridement, like incisions and drainage, tendon lengthening, skin grafts, flexor tenotomy, minimally invasive surgery for offloading, or reconstructive surgery such as partial or full amputation for severe cases. It is only considered when conservative management fails. Now that you know about foot ulcers, feel free to share to others so that they are informed. But the most important thing is to always have your regular foot examinations with your podiatrist. And if you'd like to learn more about podiatry issues, don't forget to like, share, and follow. To schedule an appointment with us, call us now at 724-775-6168 and visit our podiatrist, Dr. Latika Hinduja. Oh, and don't forget to hit that subscribe button.